Welcome to Recovery Equity, a series of conversations about how we can reach and help more people find freedom from addiction. This is a space for us to reflect on some hard truths and to consider some ways forward and even new possibilities. My name is Quyen Ngo. I'm a clinical psychologist by training and a licensed clinical psychologist at that. But right now, I primarily lead research at the Hazelden Betty Ford Foundation.
Hi, and I'm Randi Tolliver, a master trainer consultant for Hazelden Betty Ford's Publishing, Education, and Continuum Solutions Division. I hold a doctorate in clinical psychology, but am not currently practicing. I work as a trainer consultant, providing support to behavioral health and medical providers seeking to improve their practices, especially as it relates to the integration of services and the ways to serve the entire person and the communities in which they live and work. Today, Quyen and I are beginning the conversation about the Asian American experience with a focus on why we are shining a light on the Asian American Pacific Islander communities now. These conversations will address the intersections of culture, immigration, healthcare, and addiction, along with the commonalities and differences between populations, communities, and cultures. We sometimes find we are more alike than we are different. I am grateful to have this opportunity to discuss this important topic with friend and colleague, Dr. Quyen Ngo.
Thank you, Randi. It's really wonderful to be here having this conversation today.
Before we get started, would you please share a little bit about yourself and why we are talking about Asian American and Pacific Islanders now?
Absolutely. As I mentioned earlier, I am a clinical psychologist by training. My ethnic heritage is that I am Chinese, but I was born in Vietnam. So I'm part of the Chinese diaspora, which is a fairly significant part of the Vietnamese population. And so the reason that I wanted to have these conversations, we've done a number of recovery equity interviews. And we had focused initially on the Black community because of the context at the time around George Floyd's murder. And subsequently, we've had a rise in anti-Asian hate crimes. And I thought it was a good time then to turn our attention to the Asian American community, both because of what's happening in our country right now, but also because addiction is something that Asians don't talk about. We often are silent on many things, but in particular, there's a lot of stigma around addiction, around alcohol and drug use. And so I thought it was a really important conversation to have now.
Quyen, why do you think there is such a difference in how we address Black history and Asian American history?
I think that's a great question, Randi. And I think that it's important to talk about too, because we have just come from these conversations with the Black community. And my experience has often been that when we talk about historical trauma, we do talk about First Nations and the historical trauma in our country, but a lot of the conversation is dominated by the history of slavery that we've had in this country. And so in many ways, that puts Black historical trauma at the center of many conversations. But there's also been historical trauma in the Asian American community that hasn't been discussed as much. It's not that I think a lot of people don't know about it. It's not that it's unknown, it's just unspoken. And I think that can often build walls where they don't need to be. There can be a lot of compassion and empathy when we can find common ground in understanding that we have some pains that may overlap, maybe not completely, but that can give us some insight into each other's communities. I think the Asian community and the Black community have had some really mixed interactions in the past. You and I have had conversations about anti-Blackness within the Asian community. And we've also had conversations about anti-Asian sentiment among Black community members as well. And yet there's so many commonalities that we can find. I mean, you and I have a lot of things that we connect on. And I remember this experience that I had where I was traveling with a friend of mine who was Chinese, and we were taking an Uber from the hotel to the conference where I was going. And we were talking about our experiences growing up. You know, my mom did this, and she would say these things, and we were just describing our experiences about academics, about behavior, limit setting, things that we shared in common, both being Asian. And our Uber driver was Black, and he turned around and he said, "Are you sure your mama wasn't Black?" And we just all burst out laughing. We just started laughing because he saw so much of his own mother in our experiences. And so we just all started talking, and it was really clear that there were so many experiences that we shared. And I think that that's something that we don't talk about. And maybe members of the Asian community haven't had that experience, or don't understand that, or haven't had the opportunity to have that kind of dialogue. But I think it's also important, as we talk about recovery equity, that we also talk about how our communities interact with each other, and that we can come together to address some of the issues that we all face as marginalized communities.
I mean, I definitely agree with that. I think both communities share the kind of burden of stereotypes. Sometimes the stereotypes are similar, sometimes the stereotypes are different. We both share the kind of sometimes the stigmatizing beliefs around engaging in care for whether it be mental health or substance use services. And also that, knowing that you represent also within the Hazelden Betty Ford Foundation, the Butler Center for Research, the lack of inclusion in data collection and in research, not only for African Americans or Black populations, but also Asian American and Pacific Islander. And I think to your point that you're describing, there is a huge role of opportunity, I would say, for us to really express empathy and to kind of really embrace our differences in a collective way. And I think those are two things that are real opportunities, because that's one of the big questions is, how do we create a space where the lived experiences of Asian Americans and Pacific Islanders are seen as key to understanding and furthering our nation's identity? So how do we really build that up as a strength?
Yeah, and I think historically, there have been challenges and limitations, starting with the Chinese Exclusion Act, where it really limited the number of Asians that were able to immigrate to the United States. And so demographically speaking, we've been a relatively small proportion of the population, but we're one of the fastest growing. And so I think it's important to have these dialogues now. It's important also to recognize how many generations of Asians have been in the United States. That's sort of the classic example is, the Chinese workers on the railroad back when we were building our cross-continental railroad. But that's not the only contribution of many Asian communities. And so it is part of the fabric of US history. And it's something that we haven't talked about very much. So, you mentioned earlier too, this overlap of stigma, right? And within the Asian community, there is incredible stigma around alcohol and drug use, especially for women in the community. I think, in particular, that Asian American women suffer a lot of stigma around substance use, and so seeking help is a really difficult thing. There are lots of barriers to it. And I think, again, there's this commonality with the Black community too, where I talk to my Black friends, and the weight of other people's stereotypes of Black people, if they reach out and seek help for addiction, is on their shoulders. They think about it a lot. I don't know that Asians think about the fact that other people of color also, face stigma and face pressures around how they're representing their family and their community. But again, that's another place where I think there's a lot of commonality in our experiences.
Quyen, this conversation has been a great foundation to really set us up for the next episodes of the Recovery Equity series. Can you tell us a little bit about what we should expect to see?
Absolutely. Thanks, Randy. We're really focusing on the next few episodes in highlighting the heterogeneity that there is in the Asian American communities. So there are lots of different groups of Asian Americans in our country. And there's also different ways that Asian Americans have come to the United States. So we'll have a discussion around addiction, Asian American identity, and immigration, and the difference for some groups between those who chose to come to this country versus those who were seeking refuge in this country. So that's a topic that's really important within the Asian American community, and understanding the histories of those communities with the pattern of immigration, migration, and seeking refugee status is really important. We'll also be talking about South Asian communities as well, and gender and how addiction and substance use is viewed within that community. And we'll also be looking at the intersection of Asian American identity, military service, and addiction and substance use as well. And that's something that many of our listeners may not have thought about, but there are a good number of Asian Americans who are also in the military. And we also know that associated with military service, because of the stress and experiences there's also an increased risk for problematic substance use and addiction as well. So those are the next few episodes, and I'm really excited to be able to share those episodes upcoming.
Thank you so much for taking the time to really help us understand what we should expect to see and hear in these upcoming episodes. I am excited to hear more about what these guest speakers have to say. On behalf of everyone watching or listening, I want to express my gratitude for taking the time to join us today. Quyen, you have given us a lot to not only think about, but also put into practice. To everyone out there, please let your friends and colleagues know about these conversations, and come back often to catch more episodes of Recovery Equity. Together, we can build a healthier, happier, and more equitable tomorrow.